We're here once again at the University of Toledo Medical Center with infectious disease expert Dr. Joan Duggan. And tonight we're talking about changes in the way HIV testing is done in Ohio. What do we need to know about this?
Well, HIV testing is done through usually a blood sample or a swab of the mouth, and you get results back in either 20 minutes or up to 2 weeks, depending on the type of test that's done. Now, the CDC has recommended that every American ages 13 through 64 get at least one HIV test during their encounter with any of the medical systems, so either a visit to a dentist, a visit to a public health clinic, a visit to their regular doctor. Usually HIV testing is done with a very laborious consent process, but the law is changing in Ohio to make it easier for a doctor to order an HIV test. Basically, doctors will tell patients they want to order an HIV test, and the patient has the option to opt out and say no, they don't want the test. But if a patient does want the test, instead of going through a consent form that can take almost 15 minutes to explain, a doctor just checks the box for an HIV test, and depending on the type of test he runs, he can get the results back in 20 minutes or within a few days.
Okay. What sort of privacy issues does this present?
HIV will still be protected in the same ways it's always been, and there's a lot of legislation and legal protections in place for people for HIV testing, so people can't just look at that lab and know the test results either positive or negative. None of that will change at all.
Okay, can people opt out of this test if a doctor orders it?
Absolutely. You have the right to say, no, I don't want an HIV test. Absolutely. And if you don't want to get a test that has your name on it, you still have the option of going to any of the CDC anonymous test sites. They've been out there for 25 years where you can go usually once a week in most places and get a very quick anonymous test in which the only linkage you have to the test results is a number.
What advantages do you see of this change in the way testing is done?
When you do this testing with the patient's consent, you have an opportunity to give counseling to the patient, you have an opportunity to teach the patient about prevention of sexually transmitted diseases, and also you know that the patient will get the test results. In anonymous test centers, almost a third of patients who test positive for HIV never come back to get their test results.
Okay, and that means disease can spread, they won't get proper treatment, that sort of thing. So this could improve outcomes and stop the spread of disease in some cases.
Absolutely. Early intervention in HIV stops transmission and improves health. Absolutely.
All right. Good information. And this change takes place in the next couple of months in Ohio.
Yes.
All right. Thank you, Dr. Joan Duggan at the University of Toledo Medical Center. That is tonight's Talk Back.